Hello, everyone. This is Bill Connors with aphasiatoolbox.com, and I am joined today by Brooke Lang, who is one of our master aphasia clinicians here. And this month in our March newsletter, we're talking about the importance of cognition and how it relates to aphasia treatment, practice, and recovery, and in particular, attention skills. So, Brooke, we're just going to get to the point and ask you to talk a little bit with us about what you've seen about the importance of attention and how do you fold that into the work you're doing as opposed to running separate little drills and you hope it helps.
Sure. Yeah, I think attention plays a big role in aphasia recovery. It's really important for language processing and certainly reading, which is another big area that we tend to work on and our clients are usually interested in working on. I personally think it's really important to thread cognitive tasks, so attention, working memory, throughout all the language activities when you're treating somebody with aphasia, rather than doing your own separate attention task and then the language task and then a working memory task. I think it has to be threaded throughout. So a lot of the work that we've been doing focuses on getting our clients to know where to put their attention or attention allocation. So what's nice about telehealth and about just our WebEx platform is that a lot of the attention work is built in just by using the system, because the client has to know where to put their focus. Where are they attending to? Are they looking at us for a model? Are they looking at the whiteboard? They have to shift their visual attention using the toolbar, knowing which area to select. So there's some of that that's built right in, which I think is nice. And then in terms of tasks, a lot of our clients complain about reading challenges for a lot of different reasons, but a lot of times I think it's certainly related to attention, but I think it's multifactorial. So some seems to be, increased effort that's required to, read and decipher the sounds and the meanings, and doesn't necessarily leave as many mental resources to process what they're reading. So, and I think visual spatial attention is another area that's obviously necessary for reading, and it's what supports our reason for developing, the task that you've talked about in the past, Bill, the gradual reading task. So, and there's a lot of research in the field on just attention training for reading. And I know Laura Murray does a lot of work too on aphasia and attention, just in general. But another way that I've used the gradual reading task is using our schwa initiated increasing syllable task. So if somebody's not really at that full sentence or paragraph level, you can take a simple task like an increasing syllable task and incorporate reading and visual attention into it, and then have them work from their memory. I've also done just sort of a visual attention, sort of similar to gradual reading, but if a client has more challenges with reading, maybe just doing gradual sentence formulation. So having a picture of a person and then having the person and the verb or the action and maybe leaving it at that. So they have to, again, redirect their focus and their attention on that initial getting their sentences started from the beginning, which I personally have several clients who have a lot of trouble with that. They start with that object or they start in the middle of their sentence, start at the beginning. So it's a visual task, but also getting them to attend to starting at the beginning of their sentences. So that's some of the work that I've been doing. I also do some work with just a deck of cards, and I think that's a great way to use cognition just as a warm-up. I like it sort of just to kind of prime them and get them thinking, get them processing, divided, sustained attention, and I sometimes work in memory too with a simple deck of cards.
Could you give us one example of something you might do with a deck of cards relative to attention and language?
Sure. I may show, I actually have one right here. I may show a number, and sometimes it's as simple as them having to pay attention to and process what I'm asking for. So am I asking for that color, the number, the suit? So I may say number, and they have to give me the number. Add 4. Suit. You know, if they're a little bit to push that memory component and that processing, I may ask them to give me 2 or 3 components. Number, suit. Another thing I do to push the memory even more is I have them recall the previous. So I'll have them name this number, give me the one before it, or give me the suit before it.
Oh, geez,
So
I
there's
forgot.
a
Was
lot
it a
of
7?
what's that?
I forget. What was it? A
5.
7? A 5.
It was
there
a
you
5.
go. Incidental
That's 8.
memory. Okay.
Yeah, there you go. So, and throwing things at them that, yeah, they're not expecting.
Yes. Very important.
So it's,
very important.
yeah, absolutely.
Okay. Well, that's great. I really appreciate that. And the gradual reading task, we did explain that in another video in a previous newsletter, so I would defer to that. A lot of our videos are up on YouTube. So we'll be talking more about this. Thank you.